Arthritis got you down? Well, this is Dr. Mark Petrapoli. I'm an orthopedic surgeon, and I actually treat more people without surgery than I do with surgery. So I always try to treat people without surgery first and explain to them what arthritis is. Arthritis is one of the most common causes of pain in the world, and I did a little Google search and came up with the top 3 non-operative treatments for arthritis pain, and we're going to go through those. The number 1 was cortisone injections. Now, what are cortisone injections? Cortisone is an anti-inflammatory. It's a natural hormone, natural anti-inflammatory. Our bodies make it. However, drug companies make it in the lab, pharmaceutical companies make it in factories, and it's something that we inject into a joint to decrease inflammation. So it is very good for decreasing inflammation. However, it's not very good for anything else. It's kind of like a Band-Aid, and it's kind of last century's technology. We have much, much better ways of treating arthritis nowadays. Some of the reasons why cortisone is bad and I don't like to use it is because, number 1, if you do a cortisone shot, if you do have to have a surgery, you actually have a higher risk of getting an infection if you had that shot within a couple of months. Another thing is if you're diabetic, it can make your blood sugar go up. There were 2 studies that came out last year that talked about how patients who got cortisone actually developed and worsened arthritis than the patients who didn't get cortisone or the patients who got gel shots. So cortisone actually increased their arthritis, even though it helped their pain for a short period of time, but it was temporary. So it's not really dealing with the root problem. It's just masking it, and it's kind of like a Band-Aid, and turns out it probably causes the arthritis to get worse sooner. So I don't use it. So I would go down with the number 1 reason on the internet. Number 2 for non-operative was hyaluronic acid injections, and physical therapy was up there as well. So we'll talk about both those. Hyaluronic acid injections are the quote-unquote gel shots that people hear about. So hyaluronic acid is the stuff that's inside our joints. Our joints have fluid, lubricating fluid in them, and hyaluronic acid is the main component of that lubricating fluid. So there are companies that make artificial joint fluid shots that, yes, we stick a needle injected into the joint, for example, the knee, and it basically thickens up the fluid. But what it also does is the body absorbs it and it stimulates the joint to produce better fluid. So it tends to last longer than a cortisone shot. It still only lasts about 6 months. It's only FDA approved for knees. We do use it off-label for shoulders, hips, other joints, but it's temporary and it's not really treating the root problem. The gel injections can be 1 shot up to 5 shots. And again, you can get them every 6 months, but they tend to be temporary and they don't treat the root cause of the problem. As far as physical therapy goes, I do think physical therapy is an extremely useful tool. Basically, there are some things that the physical therapists are trying to do. A lot of times there's swelling in the joint, so they're trying to get the swelling down. They're trying to get the inflammation down. They're working on range of motion. A lot of people, when they have arthritis, their joint gets stiff. So the physical therapists work on mobility, getting that range of motion back. And then the most important thing is strengthening the muscles around the joint, because your muscles are your main shock absorbers, okay? What your muscles don't absorb, then the joint has to absorb. And the joint has that cartilage on the end of the bone, which is kind of like slow compression rubber. That's kind of like the tread on a tire. And as that wears down, more and more force gets transmitted to the bone underneath. Bone has millions of pressure-sensitive nerve fibers, and it tends to hurt. So the stronger you can make your muscle, the less force is going to go across that joint and the less pain there's going to be. So the problem with, quote, standard physical therapy is the way the insurance companies want it done is they don't give the physical therapist enough time. It's not the physical therapist's fault. It's not the patient's fault. It's the insurance company's fault. They only give maybe 20, 30 minutes. And if it's a knee, for example, they're really only going to pay for treatment of the knee, when a lot of times the hip, the ankle, the core, other areas of the body, even the other extremity, are causing issues that are flaring up either the arthritis in the knee or causing it in the first place. So the therapists usually aren't given enough time to really deal with all the other things that are going on, and that's why they kind of rush patients through. So standard physical therapy, it's great if they have the time, but if they don't have the time, it's really not going to do as good of a job as if they had more time to really treat not just the affected joint, but the joints above, below, and surrounding it. I hope you learned that from those top 3 right there, 2 out of 3 we really don't use anymore. What we do suggest and what we do use is PRP and BMAC a lot more, and we have videos linked down below to learn more about those.